Arthritis, often associated with aging, can manifest subtly in its early stages, making it easy to dismiss symptoms as ordinary aches and pains. One of the earliest signs is persistent joint pain, especially after repetitive movements or light activity. Unlike muscle soreness from exercise, this pain lingers and tends to localize around the joints, such as the knees, fingers, or wrists. If the discomfort does not improve with rest or over-the-counter pain relief, it could indicate an inflammatory process underway in the joints, signaling the potential onset of arthritis. Morning stiffness is another telltale sign that your joints may be in trouble, while it's normal to feel a bit stiff after sleeping. Arthritis-related stiffness usually lasts more than 30 minutes and can be quite debilitating. This sensation often feels like the joints are locked in place, making simple tasks such as brushing teeth or making breakfast surprisingly difficult. This stiffness usually eases with movement, but its regular recurrence should not be brushed off as mere signs of getting older. Swelling around the joints is another symptom that often gets ignored. It might start as a barely noticeable puffiness, but over time, the swelling can become more prominent, warm to the touch, and sometimes red. Swelling is the body's response to inflammation, and when it becomes chronic or occurs frequently in the same joints, it suggests an underlying condition, such as arthritis, that is actively damaging joint tissues and requiring medical attention. Reduced range of motion is often experienced subtly at first, but becomes more noticeable as arthritis progresses. You may find it harder to fully bend or straighten a joint, or notice discomfort when reaching for items or climbing stairs. This stiffness limits flexibility and can interfere with daily activities. People often compensate unknowingly by avoiding movements that cause discomfort, which can worsen joint function over time. Fatigue is a lesser-known but highly significant early symptom of arthritis, especially inflammatory forms like rheumatoid arthritis. Chronic inflammation taxes the immune system, leading to a constant feeling of tiredness, even after a full night's sleep. This fatigue can affect mental clarity and emotional well-being, often appearing before any visible joint symptoms. It's one of the reasons why some people with early arthritis initially mistake their condition for depression or general burnout. A grating sensation or sound when moving a joint, medically termed crepitus, can be an early warning sign of osteoarthritis. As cartilage deteriorates, the bones begin to rub together during movement, leading to this grinding noise. While occasional popping or cracking sounds in joints can be harmless, persistent, or painful, grinding indicates that the cushioning in your joints may be wearing away, a hallmark of developing arthritis. Unexplained weight loss, especially when paired with joint symptoms, may signal inflammatory arthritis such as rheumatoid arthritis or lupus. Chronic inflammation ramps up the body's metabolism, often leading to decreased appetite and subsequent weight loss. This symptom is easily overlooked or attributed to stress, but when combined with joint discomfort, it points to a systemic issue affecting more than just the joints. Joint redness is another symptom that can indicate early arthritis. When inflammation is severe, blood vessels near the skin dilate, causing the area around the joint to appear red and feel warm. This visible sign is often mistaken for infection or injury, but can persist or recur frequently in arthritis, especially in autoimmune forms. If you notice a red, swollen joint without an apparent cause, it's important to get it evaluated. Tenderness in the joints is often one of the first things people notice. It may begin as a dull ache when pressure is applied, or even a sharp pain with simple touch. Unlike muscle soreness, joint tenderness doesn't resolve quickly and may worsen with activity. This sensitivity could indicate synovial inflammation, a sign of early arthritis, and should prompt a closer look by a healthcare provider. Difficulty performing daily tasks like buttoning a shirt or turning a doorknob can also indicate early arthritis, particularly in the hands. These small, repetitive tasks become noticeably more painful and challenging as joint function declines. While many people chalk this up to aging, if it's accompanied by swelling or stiffness, it may be an early indicator of joint disease. Numbness or tingling sensations, especially in the hands and feet, could point to arthritis-related nerve involvement. Conditions like rheumatoid arthritis can cause inflammation that compresses nearby nerves, leading to carpal tunnel syndrome or peripheral neuropathy. These sensations often worsen at night and can interfere with sleep, adding to the fatigue and discomfort already experienced by many with early arthritis. Muscle weakness around the joints can also signal early arthritis, particularly if one notices a decline in grip strength or difficulty standing from a seated position. This occurs because joint pain leads to disuse of surrounding muscles, which then weaken over time. Early diagnosis and exercise can prevent this weakening and preserve mobility. An overall feeling of malaise or not feeling right is another underappreciated symptom of early arthritis. This vague sense of illness, often involving low-grade fever, fatigue, and poor sleep, can be a body-wide response to joint inflammation. Because this symptom is nonspecific, it can be easy to ignore until more joint-specific signs emerge. Noticeable changes in posture or walking patterns can also point to joint issues. Favoring one side due to pain or stiffness may lead to limping or slouching. Over time, these compensations can stress other joints and worsen symptoms. If you find yourself avoiding weight bearing on a certain limb, it's time to get checked for joint inflammation or degeneration. Some people experience depression or mood changes as an early signal of arthritis. Chronic pain and fatigue can take a toll on mental health long before a formal diagnosis is made. These emotional changes may also be fueled by the inflammation itself, which can affect neurotransmitter function. Treating the underlying arthritis often helps improve mood and overall mental well-being. Warmth over a joint that isn't due to external heat or exercise can be an indicator of active inflammation. It may be subtle at first, but is often noticeable with repeated episodes. This sign, particularly when localized and persistent, is often one of the clearest indicators of inflammatory arthritis and should not be ignored. Cracking or popping joints without pain is usually benign, but when these sounds are accompanied by discomfort, it could be a warning sign. The joints may be losing their lubrication and cartilage might be wearing thin. These signs can indicate osteoarthritis and should be evaluated if persistent. Skin changes around the joints, like nodules or flaky patches, may also point to autoimmune forms of arthritis. Conditions like psoriatic arthritis often show visible skin symptoms before joint pain becomes severe. These dermatological clues can aid early diagnosis and guide appropriate treatment. Family history plays a significant role in arthritis risk. If joint pain or other symptoms arise, and there's a known family history of arthritis, especially autoimmune types, it increases the likelihood that your symptoms are not coincidental. Sharing this history with your doctor can lead to earlier screening and intervention. Loss of joint symmetry, when symptoms occur in the same joint on both sides of the body, is a classic sign of rheumatoid arthritis. If both wrists, knees, or hands are equally affected, it may reflect a systemic inflammatory response rather than wear and tear. Early intervention can significantly reduce long-term joint damage in such cases. Recurring flares of joint pain after activity or during stress are another warning sign. These flare-ups can indicate that your body is struggling to manage inflammation and that joint structures are under strain. Keeping a symptom diary can help identify patterns that lead to diagnosis and effective treatment. Increased sensitivity to weather changes, particularly humidity or cold, may also signal early arthritis. Many people with joint inflammation notice worsening symptoms when the weather shifts. While the exact mechanisms aren't fully understood, it likely relates to changes in joint fluid pressure and nerve sensitivity. Difficulty sleeping due to joint pain or discomfort should not be overlooked. Poor sleep can exacerbate fatigue and emotional distress, creating a vicious cycle that worsens arthritis symptoms. Addressing the root joint cause early on can restore sleep quality and prevent further deterioration. Developing joint deformities, even minor ones, is a late early sign that arthritis has begun altering joint structure. These deformities may start as subtle swelling or misalignment, but can progress if not managed. Early detection and treatment can often prevent permanent changes. Frequent joint injuries or sprains that take longer than expected to heal may be a subtle signal of underlying joint instability due to arthritis. When the joint's supporting structures are compromised by inflammation or degeneration, they become more prone to minor injuries from everyday activities. You might find that rolling your ankle or straining your wrist happens more easily or seems disproportionately painful. These seemingly minor injuries can be a sign that arthritis is already weakening your joints and soft tissues, making early medical intervention especially important to prevent further damage. Changes in nail appearance, such as pitting, ridging, or discoloration, can be an external indicator of psoriatic arthritis. These nail changes often precede or coincide with joint inflammation, particularly in the fingers and toes. Many people assume such nail symptoms are purely cosmetic or due to fungal infections, but in combination with joint symptoms, they can offer crucial diagnostic clues. A dermatologist or rheumatologist can help distinguish between isolated skin conditions and those that are part of an arthritic disease process. A loss of coordination or balance may also be linked to early arthritis, especially when the joints of the lower body, such as the hips, knees, or ankles, are affected. Pain and instability in these joints can cause altered gait patterns, increasing the risk of falls or difficulty navigating stairs and uneven terrain. Early diagnosis and a comprehensive treatment plan, including physical therapy, can help maintain balance and coordination before long-term complications develop. Jaw pain or tightness is another under-recognized sign of arthritis, particularly in inflammatory types such as rheumatoid arthritis. The temporomandibular joint, TMJ, can become inflamed, leading to pain while chewing, speaking, or yawning. Because jaw discomfort is often associated with dental issues or stress, arthritis-related TMJ symptoms may be misdiagnosed or overlooked. However, early treatment can help preserve jaw function and reduce chronic pain. Frequent headaches, particularly tension-type or cervicogenic headaches, can sometimes be traced back to arthritis affecting the neck vertebrae. Cervical arthritis may compress nerves or limit neck movement, leading to pain that radiates to the head. These headaches often worsen with certain movements or prolonged periods of sitting or reading. If standard headache treatments aren't effective and joint pain is also present, a cervical spine evaluation may be warranted to rule out arthritic involvement. Unusual sensations like burning or stabbing pain in the joints may also occur in early arthritis, particularly if nerves are being affected by inflammation or structural changes. This type of pain often differs from the deep, dull ache of typical joint discomfort and may point to neuropathic involvement. The sooner this type of pain is evaluated, the more likely it is that both the nerve irritation and the underlying arthritis can be managed before irreversible damage occurs. The sensation of the joints locking or catching during movement is another sign to take seriously. This usually indicates that the smooth surface of the joint has been compromised, either by cartilage wear in osteoarthritis or inflammation in inflammatory arthritis. People may describe their knee suddenly locking when walking or the feeling that they have to shake out their hand to release tension. These symptoms not only hinder daily activities, but also increase the risk of joint injury and long-term deformity if left unaddressed. Mood instability and anxiety can also be early consequences of arthritis that are often dismissed or misattributed. Chronic pain, even when mild, can wear down emotional resilience, especially when combined with fatigue and sleep disruption. Inflammatory processes in the body may also directly impact brain chemistry, leading to mood swings or anxiety symptoms that seem disconnected from joint issues. Recognizing the holistic impact of arthritis on both the body and mind is essential for effective treatment and support. Digestive issues or gastrointestinal discomfort may arise as a secondary effect of arthritis, particularly autoimmune forms like lupus or psoriatic arthritis. While not a primary symptom, the systemic inflammation involved in these conditions can disrupt the gut microbiome, leading to bloating, indigestion, or alternating constipation and diarrhea. These symptoms are often misdiagnosed as irritable bowel syndrome or stress-related, but in conjunction with joint complaints, they may reveal a more systemic autoimmune condition. Lastly, dry eyes and dry mouth, common symptoms of an autoimmune condition called Sjogren's syndrome, can appear alongside rheumatoid arthritis and may even precede joint symptoms. These symptoms result from the immune system attacking moisture-producing glands, leading to persistent eye irritation or difficulty swallowing dry food. When combined with early joint pain or fatigue, they present a clear red flag that immune-related arthritis may be developing.